Hi, I am Amber Fee, a reimbursement specialist with the Small Business Education and Entrepreneurial Development Office, or SEED office. Today, I'm going to be providing a webinar on an overview of medical code sets. Today's webinar will answer the questions: what are medical billing codes? What role do codes play in billing for medical services and devices? And what medical billing code sets are important to innovators as they are developing a reimbursement strategy? Coding is an integral part of an innovator's reimbursement strategy because coding is how you get paid. An innovator needs to understand the entire commercialization process and establish both a regulatory strategy and a reimbursement strategy. Understanding code sets and how they correspond to your medical product and billing will help you to develop a solid reimbursement strategy. There are several medical billing code sets, but the ones that I would like to briefly cover today are the CPT codes, the HCPC codes, or the Healthcare Common Procedural Coding System codes, and the ICD-10 CM codes, or the International Classification of Disease codes. These three code sets will likely be most important to innovators as they are developing their reimbursement strategy. So what are CPT codes? CPT codes are 5-digit numeric codes used to report the professional services provided by qualified healthcare professionals. Qualified healthcare professionals are physicians, physician's assistant, nurse practitioners, psychologists, and social workers, or anyone whose license allows them to submit a medical claim. CPT codes cover medical, surgical, and diagnostic services. CPT codes are maintained by the American Medical Association, and here we see a couple examples of CPT codes. A 73610 is a complete ankle x-ray, 3 images. A 99202 is a new patient initial office visit. HCPC codes are alphanumeric codes describing specific items such as durable medical equipment or pharmaceuticals that are provided in the delivery of health care. Just to be a little bit confusing, you may also find that HCPC codes describe services that are not described by CPT codes. HCPC code set is maintained by the Centers for Medicare and Medicaid Services, and a couple examples of HCPC codes are the E0114, which is for underarm crutches, the L1906, which is for an ankle-foot orthosis, and the G4026, which is for physical therapy / occupational therapy MIPS specialty set. What are ICD-10 CM codes? ICD-10 codes are diagnosis codes, and they are usually 3 to 7 digits in length. They are used to report the patient's condition or disease state. They are maintained by the CDC's National Center for Health Statistics, and the World Health Organization owns ICD-10 and authorized the National Center for Health Statistics to develop the ICD-10 set for use in the United States. A couple examples of ICD-10 CM codes: S82 is a diagnosis code for fracture of the lower leg, including the ankle, and the E83.51 is a diagnosis code for hypocalcemia. When we think about HCPC codes and CPT codes, I'd like to draw an analogy for you. When you go to the grocery store and have selected all of your items and approach the checkout counter, the cashier will scan a barcode for each item. As the cashier scans that barcode for each item, a description of the item will appear on the screen. Very similarly, a CPT code and HCPC code are codes that represent items and services in the healthcare system. Let's put this all together in an example. In our example, we have an individual who has broken their ankle. So this individual is going to encounter the healthcare system via a doctor's visit for a new patient, which is represented by CPT code 99202. And our physician orders an x-ray, which is CPT code 73610, and also some crutches and an ankle boot, which are represented by HCPC codes. The diagnosis is a fracture of the lower leg, including ankle, which is S82, and the physician has ordered physical therapy services to aid in the healing process, which is represented by a HCPC code G4026. A couple key takeaways from our webinar today. Medical codes describe the goods and services used in the care and treatment of the patient, and are essential to getting paid for medical services, drugs, devices, or diagnostic studies. Reimbursement for medical products and services relies on the use of medical codes on claims that are submitted to payers for reimbursement. Innovators should be familiar with 3 medical code sets: CPT codes, HCPCS codes, and ICD-10 CM codes. To end today's webinar, I would like to show you some opportunities to connect with SEED. They are on the left-hand side of the screen. You can connect with SEED online through email, Twitter, and LinkedIn. On the right-hand side, you see opportunities to sign up for NIH and SEED updates, as well as to take a look at the NIH Guide for Grants and Contracts. I hope you've enjoyed today's webinar. Thank you for listening.